Howdy everyone, Matt here. I got a question for you. Thinking back to your days as a student, do you feel like those clinical rotations got you ready to see the patients that you saw those first few months or years as a PT or PTA? And do you feel like the students now are, during their clinical rotations, get a good, accurate picture of how it is to be a PT or PTA? But first, let me introduce myself. My name is Matt. I am Matt the PT, and I'm coming at you with another video on another topic of something in the physical therapy world. Second of all, thank you so much for taking time out of your day to tune into the videos. Thank you for the likes. Thank you for subscribing. And most of all, thank you so much for the comments and the discussions to have on these topics. And if you feel so inclined, please hit that subscribe button down below. It won't cost you a copay or anything. And also, let me know your thoughts on any of the topics that we talk about. I do believe it is very important to have an open dialogue so we can understand these things better. Now, what I want to talk about is clinical rotations on there, and do those fully get patients ready, get PTs and PTAs fully ready to treat patients, to be a full-fledged PT or PTA. And I think that there's times that possibly not, and I want to talk about that. So first part of it, this was something that came up once when I was a CI years ago. I just haven't taken students in a long time due to where I work. We just don't take them. But at the time I was running a clinic, and we were a very busy clinic. So I was seeing a lot of patients, and we had a very busy clinic at the time. And being the clinic director, I was working crazy hours. So anywhere from 45 to 50 hours a week, sometimes more, really depending upon it. That's another discussion for another time. Now, I was having a hard time hiring additional staff. I did have a PTA on staff, but where I was, there just wasn't a big job market for other therapists in the area. We just didn't have a surplus of them. And really, I kind of joked that many of the therapists there just kind of rotate around to the different places. Like, it's the same therapist all the time. They just kind of shift employers over the years. So I was working, like I said, a crazy number of hours, and I had students that would come in, and I would tell them, we start seeing patients at 8 o'clock. We take our last one at 4, and you can leave when your notes are done, so that you do your notes. And I was always trying to be fair to students as well, with things like, if you want to document over lunch, if you got a little time, you can. If you got downtime or whatever, do your documentation. I'm not going to force you to do it. Take your breaks or whatever, to do. And I had several students when they had to document their hours during the week and total it up. And they were, again, that's what the realization for me was, that they were hitting that 45, almost 50 hours a couple times. And I'm like, holy cow. And they had, when they submitted, their person at their college was saying like, oh, well, if you do that, you don't have to do more. Once you reach the total number of hours, it was something like there's 200 hours or so, however many hours total that they had to do. They're like, oh, when you get that, you can be done on it. I really had the belief, and this is what I shared with both the students and the clinical people, it's like, this is real life on it. And to say that really, just expect, like on your rotation, to just do your 8 hours and go home, and just do your 40 hours a week and go home, may not be a good reflection of what you may end up with as a working PT or PTA. Now, I am not sitting here saying like, oh, you need to work 45 hours and 50. I'm not saying that, but saying that there could be times in someone's career. So you got busy weeks. You may work in a very busy clinic. Those things that you will see more patients, that you will have to work those longer hours. And understanding this is something that may come up. You may have to do this on it. And so that at least that you're ready for it. And I will say, all the students were very accepting of it. They were saying, no, I completely understand. I would do that. I always try to make sure, like, when they finish their notes, I check their notes first to let them go home early. But I did express this. This is something that you may come up in. So that you're ready for it. When you become full-fledged, when you're licensed PT or PTA, that this is something that could happen. And this also, you can realize, hey, I don't want to work this much. And I am, again, that is something I am all for, working 45, 50 hours a week, 60 hours a week. Some people like that. Some people are like, hey, that's fine. But if you find that and that doesn't work for what you're doing, hey, I was like, if you see that and it's just too much, you can work yourself over into something that are working the hours that work best for you to allow you to do what you want to do. Now, kind of moving up a little bit, the other thing that I really don't feel like students get prepared for is the actual business side of running a clinic and like the why. Why are you having to bill these different things with the patient? So as patients comes in, what is the reason why that you want to differentiate between a TheraX and Theractivity or neuromuscular reeducation and the different, the complexity of evals or re-evals or this, what is the why behind that? And I found that many students really didn't know that. They didn't know like why. And I will say it, when I was a student, no one ever went over that business side of it. Why do we have to build these things? Why is the owner, is the manager, talking about these different things of units? This is how many units with this and this with that and this with that. They didn't have I didn't have an understanding of it. And then when I started running a clinic, I had to learn that. I had to understand that of everything that I did as a clinician would reflect on the business end on it. So it wasn't just the treating, but it was when staff is there, what are the things you're purchasing for the clinic, the insurances that you see. And I found, I don't believe a single student really ever understood this coming in. And they did not know why they were billing what they were billing and what the rationale was behind it. And one thing I would always make sure I did with every single student, didn't matter if you're a PT or PTA, is I took a period of time. I said, we're going to pull out the books here for this clinic, and we're going to go over that. And we're going to go over, this is what we build out. This is what we actually get in. These are the costs that we had. This is what percentage of it was labor, so that you understand why your management is going to come at you and talk about like, oh, you need to send the techs home early, or you need to watch this person's hours. So to understand those things, why you can't buy this, cool treadmill that you saw at CSM, why we really can't buy that, because yes, it looks really cool, but we don't see enough patients to really, really utilize it. Or, the insurances that come in. What are the differences in insurances? Because some pay better than other ones. And so, yes, and we would break this down. Yes, you may see a lot of patients. You may see, oh, we saw 200 visits this month and our budget was only 180. But you were seeing an insurance payer that paid a lower amount. So you didn't hit your budget because you paid you saw this insurance that paid a very low amount. We had one that would pay $40 a visit. So it was a very, very low payer. I said, yeah, if you get something like that, and that's all you happen to be seeing, you may have to make cuts elsewhere to see these patients by saying, okay, we can't have the techs here quite as long to have to save a few dollars here. Okay, we're not going to expend, we're not going to buy more supplies this month because we can make it through this month. But they weren't really ready for that. And I noticed that really carried over as well to other therapists that I've met through the years. When they first get out, they're like, it took me a long time to really understand the business, why clinics are doing this, why my bosses are saying this, and why we have to do this and why we can't do that. And it took them several years, and some of them still don't fully understand on it because no one takes the time. And that'd probably be a different talk and a different time really on that part of it. But like I said, I don't think that we prepare students as well to really understand the business side of it. Now, the biggest thing that I really want to talk about, that really, really brought this up, about that sometimes I don't think as a student that they get the full experience and to be ready, is that we can often cherry pick the patients that we give them, that we're only going to give them the most optimal patients. Those ones that are like, oh, these patients are going to just get better, through our clinical expertise and skill that we know, hey, this person, if you just work with them for 6 weeks or 4 weeks or what have you, they're going to get better. You can do whatever exercises that you want with them. They're going to get better. So we give those to them because it's just going to be easy. There. But does that really get somebody prepared to be a licensed PT or PTA on it? So I know in cases of it, now it can really, really depend. Now, like when I get somebody who's coming in from the very first one, no, I'm not going to give, very difficult patients because this person, I would talk to them. What have you had in class? What classes have you had? So if you have not, I work in orthopedics, outpatient orthopedics. So if this person had not had covered spine yet, okay, possibly I'm not going to give you spine patients on it because you haven't covered that in school. You may not really understand it. So yeah, I'm gonna give you these other ones on it. With a PTA student, I don't have them have to do an eval on it because that's not part of their curriculum. Often it wasn't on their grading. They're not going to do that when they're out. So, but you'd sit in on an eval with me to get an idea and understanding of what we're doing. But understanding that's where you are. But really, when somebody gets to be in a third year, that very last rotation, and I'm sorry if I use incorrect terminology and stuff on that, I'm just basing off what I have seen. But say somebody's on their last rotation or second to last rotation, depending on some of the schools. Because some of them, I think, do like 2 or 3 right at the end, or correct me if I'm wrong, one or, it's maybe multiple. So like you do one rotation and then you turn around and do another rotation and then you're done. But when you really get to the end of school and you're on those rotations, do we actually treat them as like, hey, you're a licensed PT or PTA, I should be able to hand you a chart and that you treat that patient. And it's hard to say no different than the other therapists there because, again, there's some skill and experience level that will come along with it. I completely understand that. But there shouldn't be any real difference in it. And I found sometimes that still CIs don't give them the difficult patients in terms of hey, this patient is very complex. There's a lot of stuff going on. There could be multiple things going on. It's going to take a whole lot to work with. So it's like, no. We're not going to give it to let our student that we have, we're not going to allow them to treat this patient because I need to do that. And is that really fair to that student to not see that and not put themselves in there when they actually have a safety net of you or their CI with them to say, hey, you're going to do what you're going to do. I'm going to be here with you and supporting you through it as well. And also when we talk about complex patients, what about that patient that just has a lot that's like has a lot going on, but has a lot of frustrations, who are angry that are coming in, maybe yelling or they're, argumentative about stuff. How often have you found that, oh, no, we're not going to give that patient to our student because we don't want them going through that on it. But what happens a couple months later once they become licensed? They're going to have that patient. Are you going to be able to just say, no, another therapist has to take it? It's going to be like, no, you got to have your own caseload. And again, you got somebody that's got your back on it. And how often does that happen? To say, no, you're not going to have this time. But to get them to learn how to communicate, to be put in a situation like that, I was like, okay, see, I know this was a tough situation. You weren't going through it alone on it, but I was here with you, and I just want to see what you do on there. And likewise, some of the weird things. So take, for example, like if somebody is coming in that has a workers' compensation claim or was in an accident and there's litigation. How often as well do we say, we're not going to give it to the student for those? Now, I 100% understand those situations can be interesting because, that stuff could be pulled into court on it. You don't want to get them involved on it as well because you just don't want to get this student tied up. But again, What happens in a few months when they are a licensed PT or PTA and they do get brought into this and they have to try to understand how to work with them, and it wasn't them on the line. And again, like I said, that could come down to policies and stuff that we have in our clinics and stuff. Totally understand. But does that really get them ready? And of course, the biggest one that always drove me nuts is when you get physicians and they're like, I don't want the students seeing them. This is the goofiest thing, especially if it was a student on their last rotation. Say it's like end of April, and some physicians like, they don't want the student seeing the patient. What's the difference in that student who is a student at the time in April and when they pass their board exam, their licensing exam in July? What is the difference in that period of time? Did they really gain a whole lot more skill and knowledge in that little period of time? Probably not. Probably a little bit, but you've also had a lot of time of study. There's no different. It's just a period of time and a passing score on an exam. There's no different on it. So, and it's like, okay, would you say, I don't want the new therapist there treating that patient? I don't think I've ever heard that. You may have heard that, but it's like, I don't want the first year student, the first year PT. And again, then even what even turns into, what's the real difference between someone who's in their first year of working versus their like second year? Really not a whole lot of difference. It really could be, on it. So really, it's just a time thing. I always thought that was like the goofiest thing, but I understand we sometimes do it to keep good relations with providers and things like that. But, really, is that really good for them? So now I want to say a couple things about it. I have also had some times that the employers I worked for, they wanted to use the PT and PTA students as like free labor. And I did not like that. And I never felt that was good. That they would say like, oh, make sure that you take on students. So they want you to take on students so that you can fill your schedule. So then it's like, oh, look, it's all going under you. So you're, seeing more because it's under you who was signing off on it. So it increased your numbers. And so, oh, you're just seeing more patients. Well, yeah, it's two of you. And you're not paying this person. And they wanted that. Oh, we're not paying the student over here, but we're seeing more people. So we're saving money and we're making more money off it. I never felt that was right. And I would not do it on it, because I do feel you need to be there supervising a patient. Hey, I need to be with you if you have questions or something comes up. I'm not going to say, okay, here's your patients over here, and I'm going to treat mine over here at the same time, and we're going to do that, and we'll just bill it. You're not learning anything on it. So I never like that. And also as well, not throwing students to the wolves. And I've heard of people do that. They come in, hey, here's your stack of charts. Good luck. Have fun. Come see me at the end of the day. I'll just sign off on your notes and do all that. I don't find that that's right as well, because again, the whole point of that clinical rotation, that clinical internship, or whatever that is called, is for them to learn, is to get them ready to work as a licensed PT or PTA. And now I know that's what I always try to do, is try to get you ready in so many different facets. And I would tell you, you're probably not going to see everything while you're here, because we're limited to what happens to come in. So you may not get to see knee replacements because they were not coming in. You may not get to see a rotator cuff repair. You may not get to see an ACL reconstruction. You may not get to see certain things because we were just limited by what happened to come in. Then I would tell them, you're not going to. So don't beat yourself up, but you're going to learn more. We're going to work as much as we can with what we have to teach you these aspects and try to make it as real as possible. Because I said, within 6 months, I said, it's going to be you in this seat, and you won't have anyone else behind you, backing you, supporting you, and doing those things like that. So that's what I feel. Sometimes I don't feel, from stories I've heard, that students are fully ready when they get out. So let me know. Have you dealt with that? Did you deal with that as a student? Did you feel like you were accurately prepared? during your clinical rotations to when you got out? Have you seen other therapists that you may have worked with or know that don't fully prepare those students to be ready out there? And what do you feel would be the best way to really get them ready on there? So let me know. Drop that down in the comments. And of course, if you like the video, hit the thumbs up button and that subscribe button. It's down there. It, like I said, doesn't cost you a copay or anything to hit that like that. So until next time, take care of yourself, take care of your patients, and I'll see you then.